There's been many painful years for Deanna Valles after nerve damage from previous injuries and neuropathy in her feet took away fully enjoying her cherished grandchildren. She loves to play with the many young kids who call her grandma, but most days the pain was just too much. Her life is much different now, and it isn't because of heavy pain meds or numerous surgeries that healed her. Have a look.
I'd had chronic back pain, leg numbness, neuropathy in my feet. It had been going on for quite a few years. It limited me from doing some things with my grandkids. We do a lot of walking and hiking and stuff, and I couldn't do that without a lot of pain. I could do it, but at the end of the day, I was in a lot of pain where I couldn't move out of a chair. It just was very painful. Either get it fixed or just put up with the pain for the rest of my life. And I didn't want to do that because I want to be able to do things with my kids and my husband and my grandchildren, and they like to go camping, they like to go to the lake, they like to go to Wild Island, and I want to be part of that. I don't want to be stuck in a chair.
Deanna went to Nevada Advanced Pain Specialists and met Dr. Dennis Patterson, where he proposed testing the effectiveness of a spinal cord stimulator.
And I did the trial, which was a 3 to 4 day, and as soon as the trial was over, I was like, how fast can you get it done? And then when I had the actual surgery, the battery pack is placed in the lower back of my back, and the leads are placed into the top. The surgery was probably about an hour, and then the recovery was about 2 to 3 days.
The spinal cord stimulator is so discreet, Deanna says she doesn't even know it's there. And recharging the battery is every 7 years.
It made that much of a difference in the walking and the pain, getting up in the morning and not having your feet cramp up on you. And the neuropathy pain is reduced a lot. And that was a lot of my pain, was in the neuropathy in my lower back and my left leg. So I do a lot more now. It's been an amazing change for me. I love it.
So happy for Deanna. Everybody meet Dr. Patterson. He's with Nevada Advanced Pain Specialists here in Reno. Dr. Patterson, she talked about that device in her back that helped with the neuropathy and the back pain and the numbness in her legs. It does pretty amazing things. Tell us about it.
Absolutely. So Deanna had a pinched nerve in her back, and she didn't get better with conservative care. And she came to see me, and she was looking at other options because she wanted to avoid surgery. And so Deanna and I had a conversation about, expectations and what surgery can help with. And I promote patients to go see a surgeon or have surgery if they have progressive neurological loss or bowel or bladder incontinence. But when they just have pain, like in her condition, I look at other options, and therefore I offered her a stimulator to see if I could get rid of that pain and make her feel better.
Right, and so it's interesting that it can be put in and tested, right? Or not even put in first. Yeah. You can have a little trial and decide if you like it.
Correct, and that's what I told Deanna from the get-go is like, look, you can try this out and see if you like it. So she comes into my office, and over a 5-10 minute period of time, I can get the leads into place. And she walks around with the device for 5 to 7 days and see if it helps her pain. She comes in 5 to 7 days later. If it works, we take out the leads, and then we set her in to have it surgically implanted, which takes only 30-40 minutes. The other nice part about the implant is that no body parts are removed, so if it doesn't work long term, it can always be taken out, and her anatomy is still the same. Can't say the same for surgery. You can't go test the surgery and then if it doesn't work, have your body parts put back in.
It's a great option for people like her to be able to be active and healthy and enjoy her grandkids and not have a major back surgery, which is so scary to people. And I know it's called a spinal cord stimulator, which is kind of a, I bet when you first say it to a patient, they're like, wait a minute, but it's not as scary as it sounds.
So the term spinal cord stimulation sounds scary, but the truth is it's no different than having an epidural. An epidural is done, millions of times daily around the world. Women with pregnancies, they go into the hospital and they have a needle put into the posterior part of their spine. They have a catheter put up, medication to help them deliver the baby without pain. That's exactly what I'm doing with the stimulator. I'm using the same kind of equipment, but instead of putting numbing medication or injecting steroids into that same area, I'm actually sliding a lead up that has electrodes that I can use the electricity to change the patient's perception of their pain to the brain.
Amazing, and I just really appreciate all that you're doing in our community for not only seniors, but seniors in a lot of ways, right? Correct. A lot of seniors in here.
Yeah, it's amazing. We have a lot here.
Good. Well, I'm so thankful for you. Dr. Patterson, we'll have you on the show again soon. For more information on Nevada Advanced Pain Specialists, you can head to our website, agingandawesome.com.